Next speaker, Maria Lourdes Vega, Chief Nutrition Policy and Planning Division, National Nutrition Council of the Philippines.
Good afternoon, everyone, and thank you for this opportunity to share some insights on investments for nutrition. And I'm so glad I came after you because you're saying much of the funding should come from domestic sources. And in countries like the Philippines, we really have to rely largely on domestic sources, so which means the national budget and the local government budgets. The nice development for the past 10, 15, 20 years is the serious purposive intent of harmonizing development planning with development budgets, so that the national budget should support the national development priorities. It's the same thing with the local government, and therefore nutrition agenda should be in that development plan from the start to make sure that it gets financed. And it has been financed to some extent all this while. The second point is we have tried to increase these levels of investments through legislations. For instance, the Sin Tax Law of 2012 provides that the incremental revenues generated will be used for health insurance, improvement of health facilities, health awareness programs. The recent tax reform legislation that includes the taxation of sugar-sweetened beverages includes a provision that, well, it's a big part. So 30% should be shared by the social services sector. That includes programs for targeted nutrition, anti-hunger programs that target pregnant women, young children, and infants. So those things are there. Health insurance may seem to be so far from nutrition, but we've actually used health insurance as a way of, let's say, promoting breastfeeding, because for a health facility to avail of the health insurance benefits, they have to be accredited as mother-baby friendly. And therefore, that is a leverage point by itself. Local governments are a big source of potential investments for nutrition. As I said earlier, we need to make sure that nutrition is in the development agenda of the local government units, which means we should be ready with that agenda when the new elective officials come into office, because that's when they set their agenda. So it's not when they're in office, but way before, so that when they're there, we're ready to give it to them. And recently, with the help of a consultant that was engaged through the help of Nutrition International, we developed a very simple Excel-based tool that helps them compute budgets for nutrition-specific programs in the first 1,000 days. And the local government functionaries we interacted with were very, very appreciative of this tool. The second point is it's not just all about investments. It's making sure that the investments are used well, because if you use it well, then you're assured of increasing investments. And therefore, issues of procurement, issues of supply delivery, issues of distribution should really be settled, because you don't want outages of supplies at the service delivery level. You also need to make sure that all the other elements are there, because it doesn't make sense to invest in in managing acute malnutrition, buying the supplies needed, when there is no system for active case finding. Then it just doesn't really make sense. Or investing in micronutrient powders and folic acid, iron folic acid, without a system for following up so that they're actually used at the household level. And I think therefore the point is to have that absorptive capacity to show that you are able to use the investment. The third point I'd like to make is that investment in nutrition is not simply an investment in nutrition. It actually is an investment for small farmers, for rural women, because, for instance, the investments in the Philippines for feeding programs in daycare centers and in public elementary schools runs to about 125 million pesos a year. And if the food that's used is taken from the local farmers, then you help address poverty concerns. We've also started testing the community kitchen thing for centralizing all the food requirements for supplementary feeding. and engage community women to actually prepare the food and deliver the food and all of these things. But it's not. It becomes a venue also for additional income, an opportunity for learning on food safety, meal planning, and all those related concerns. So, so these are the 3 points I'm trying to make. We can use domestic sources, and in fact, there are many ways of using the domestic source. The second point is it's not just about investment, but in actually using the investment efficiently. And the third point, it's not simply an investment in nutrition, but in also anti-poverty efforts. Thank you.
Thank you very much.